Today I want to talk about anticoagulants. Over the past few weeks, a lot of people have asked whether anticoagulants can stop the formation of microclots in long COVID. The short answer is probably not, based on the available data. There's currently no data that shows that anticoagulants alone, as a monotherapy, prevent microclot formation, break up existing microclots, or act as effective treatment for COVID. The detailed pictures is a little more nuanced, though, and very unsatisfying, and honestly infuriating. There have been studies done using anticoagulants to treat COVID, but there's several issues with them. Issue number one, the studies that have been done were performed on patients with acute COVID infections, not long COVID. Issue number two, the studies that have been done don't specifically analyze microclots in those patients and whether the anticoagulants broke up the microclots or stopped more from forming. The studies all used improvement or worsening of patient condition as the measured outcome. Issue number three, when anticoagulants were tested in these studies, the results were underwhelming. In one clinical trial, therapeutic anticoagulation, quote, did not improve clinical outcomes, unquote. In a second clinical trial, quote, heparin increased the probability of survival to hospital discharge, unquote. That's it. So in short, the studies performed to date didn't use the long COVID patient population, had no assessment of a molecular level outcome on microclots, and showed anticoagulants didn't help much in the outcome they did measure. That's the unsatisfying part. Now the next question most people will ask is, why hasn't someone run the right study with long COVID patients that examines microclots before and after anticoagulant treatment to see if they work? That's the infuriating part. It appears that despite the published evidence that microclots occur in long COVID, no one has tested anticoagulants as a monotherapy to treat long COVID. So the real answer is that we don't know if anticoagulants alone work to treat long COVID, and no one seems to want to find out, which is mind-boggling, especially with all the money dumped into COVID research and clinical trials over the past 3 years. Putting aside the suboptimal trial designs and the lack of data related specifically to long COVID, there is a logical next question to ask. Why did the anticoagulant therapies fail to show improvements in acute COVID patients? I'm investigating that question now, and will have some thoughts and information for you in my next post, so stay tuned. Let me know your thoughts in the comments below, and you can follow my research and give me feedback by making a comment below, checking out my bio, and following me. Thanks.